welcome back. You're still with us here on the C Morning Show as we now head into the final hour of our show. We're up for our second discussion of the morning where today we're highlighting Lung Cancer Awareness Month. Now, it is a crucial time for us to talk about the prevention, early detection, and support for one of the world's deadliest cancers.
Yes, that's right, Paul. And today we'll dive into lung cancer risks, including concerns about vaping. Aside from exploring what steps we can take to develop healthier lungs and a brighter future. And to find out, let's welcome pulmonologist and thoracic oncologist Dr. Hana Khairina Putri Faisal. Good morning, Doc.
Good morning.
Good morning.
Thank you for joining us.
Thank you for having me.
Great. So let's talk about first of all, the risks and chances of developing lung cancer. We know this is one of the more common cancers around the world. What are some of the key factors that do increase the risks of one developing lung cancer, and what are the methods that we can use to try to reduce these risks?
So, lung cancer risk factor are first smoking. This includes active smokers, ex-smokers, and also exposure to secondhand smoke.
Like people who don't smoke at all, but just
Yes.
are exposed to it in a room.
Yes,
Okay.
and also exposure to the carcinogen such as asbestos, and then air pollution, and radon gas, and also family history of cancer, and also previous cancer of the patient, and also the chronic lung diseases such as COPD, and also previous tuberculosis disease. So
Also, if you've ever had TBC in the past, is that right?
Yes, because the theory is chronic inflammation in the lung can lead to lung cancer.
I see. And now, what are some of the early warning signs or symptoms that determine someone might have developed lung cancer?
Yeah, so the problem is the early stage of lung cancer may have no symptom at all.
Okay.
So asymptomatic. So it's the challenge for us pulmonologists, because the early stage of lung cancer, sometimes the patient it's a accidental finding, so no symptom at all.
Okay.
However, some patients may develop such as persistent cough,
Okay.
shortness of breath, maybe bloody sputum, and also weight loss, but unexplained weight loss. So this may be the early stage of lung cancer, but this also can resemble with other lung diseases. So it's
Right.
very difficult.
Right.
So it's better if you have a risk factor for lung cancer.
For example, like hereditary.
Yes,
Okay.
and you can come to the pulmonologist or go to the doctor to find a medical evaluation or medical help to detect early
Early
for lung
detection.
cancer. Yes.
So this would come in the form of lung with screenings, for
Yes.
example. What happens throughout a screening? What would happen? Let's say if I came to the doctor and first.
Yes, so the doctor will try to identify the risk factor first,
Okay.
and maybe ask for the symptoms. And sometimes the doctor will order radiology testing, such as X-ray, chest X-ray, or low-dose CT scan.
Okay.
So low-dose CT scan is proven to be very effective to detect lung cancer early, even though the symptom is not appear yet.
Oh, okay. Even the asymptomatic
Yes,
situations.
yes.
What's the difference between a low-dose CT scan and a regular CT scan?
So
I've had one.
low-dose CT scan is like it's mentioned, low dose. So the radiation dose is lower
it's
than
the
the regular
radiation.
CT scan.
Okay. Okay, so let's, prior to getting to the screenings or getting ourselves tested or even looking for any symptoms, you mentioned a lot of the situations that could expose us or increase the risk of lung cancer. What are some of the things that we can do to prevent that? Apart from, I mean, for air pollution, maybe wear a mask when you're outside. I think many public places now are made to be non-smoking. Like if you want to smoke, there are smoking areas.
Yep.
But to actually, unless you're actually a smoker, are there any additional things you can do to help reduce the risk of exposing yourself to lung cancer?
Okay, first, quit smoking.
Okay, if you are a
At
smoker,
all.
quit. Right.
If you're a smoker, quit smoking at all, once for all.
Okay.
And then if you are exposed to, for example, asbestos, you can wear the PPE or personal protective equipment for yourself.
Okay.
And
asbestos are basically those things that it's still being used these days, right?
Yes, yes.
For
industry and for the roof.
roofing,
Yes,
insulation,
yes,
and things
yes,
like that.
Yes,
okay.
yes. And if you have a family history or maybe previous cancer, it's suggested that if people above 45 years old, it's better to do screening regularly.
Regular screening.
Yes.
And what would that be? Once a year?
Once a year,
Once
at
a
least.
year.
Okay.
At least.
At
yes.
least. Okay.
Now, Doc, you mentioned that if you're a smoker, to stop it once and for all, right? But we've seen that over the last few years, vaping and e-cigarettes has become bigger and
alternative,
bigger.
right?
Yeah, an
To
alternative to
smokers, yeah.
smoking, and they make it as if it's a good thing that it's better than smoking, but
Yes,
actually not, right? Now, how do you think that it affects also towards lung cancer?
So that's also the challenge for us because especially vaping targeted young adults, so they can expose to these harmful substances since the early age. So it's also a problem. Okay. So that's one. And then vape or e-cigarettes also contains harmful substance and carcinogen such as benzene and formaldehyde. Okay. So benzene can lead to lung cancer. Formaldehyde can damage our lung irreversibly. So if the damage has been done, it cannot be recovered.
Cannot be fixed.
So,
okay.
yes. So that's the problem of e-cigarettes.
Okay, so we often hear this argument. I just want to add a follow-up question that if one is a heavy smoker or a regular smoker, switching to vaping can actually help reduce the risks. Is that part actually true?
So the study showed that because the e-cigarette also has the this harmful substance.
It's basically a different type of risk that you're taking, correct?
So still the chance for lung cancer is still high. So like I said, it's better to stop or quit smoking at all. No cigarettes or no e-cigarettes. Yes.
Gotcha. Okay, so there are many myths and basically misconceptions as well. Some of them, one that I mentioned earlier as well. What are some of the other ones that people believe in regards to, like for example, in the United States there are, or in other countries where it's legal, there are certain states that THC vapes are illegal, and most people are confusing that with nicotine vapes. Do all vape or electronic cigarettes contain those similar chemicals that you mentioned earlier?
So if it contains nicotine, nicotine can make us addictive. It's an addictive agent. It's addictive stuff. So if you use nicotine, you tend to smoke more and more and more and more. It's hard to quit.
Right. Okay.
So if there's benzene inside the vape, so you tend to more carcinogen to your lung. You put the carcinogen inside your lung more and more.
Because of the nicotine, it gets you hooked.
Yes.
Gotcha. Okay.
But if there's no harmful benzene, the vape itself contains formaldehyde. This formaldehyde that the problem as well, because it can irreversible damage to our lung.
Yeah.
Right.
Damage or inflammation, chronic inflammation in our lung also can develop lung cancer. So
just regular inflammation?
No, chronic inflammation. So inflammation for a long time.
I see.
Over time, later damage the DNA, and then later lead to lung cancer.
Okay.
It depends of the time, maybe 10 years, but it still can develop a lung cancer.
Wow. Okay.
I'm curious, since you mentioned something that was irreversible. We know that there are treatments for different types of cancer, and we do know that some cancers are harder to trace than others. When it comes to lung cancer, it is one of the, we mentioned earlier, it's one of the cancers that is the most deadliest.
Yep.
What does that exactly mean? Is it the hardest to treat? Is it one of the cancers that is hardest for people to basically on record recover from, in your definition?
So first, if the cancer is still early, there's no symptom, so that's one challenge.
Okay.
So sometimes, most of the time, we find the cancer at the late stage.
Which is stage
Which is
4,
the bigger size and then already spread to all over our body, to the brain, to the lung, to the liver, to the other lung. So lung is a very vital organ.
Absolutely.
If you don't have your lung, you cannot breathe.
Yep.
If you don't breathe, it's difficult for you, and it's maybe you cannot survive. So because of these vital organs, and if there's more tumor, bigger tumor, it's harder for you to breathe. That's why it's difficult if you find the cancer at the late age. And also, the late stage usually very difficult to treat because lung cancer is very aggressive and progressive.
Okay.
So we are running out of time if we treat the lung cancer at the late stage.
Okay.
So it's very it's better and better outcome if you find the cancer in the early stage.
Okay. Early detection is key.
Yeah.
Yes.
Doc, just one last question. So you mentioned a lot about smoking, but we live in Jakarta where the air pollution, especially these days, it's not the greatest. When it comes to its risk towards lung cancer compared to smoking, how big is it?
Still, smoking is the biggest, the primary risk of lung cancer. Compared to the non-smokers, smokers have 15 to 30 times risk for lung cancer, not twice.
Oh,
not
15 to 30 times.
15 to 30 times
percent,
risk of lung cancer.
Okay.
So still, the smoking is still the primary cause of lung cancer. However, air pollution also can cause lung cancer, and we divided air pollutant into first the indoor pollution and outdoor pollution. Indoor pollution sources are, for example, the cooking from biomass fuel, and also exposure to secondhand smoke, especially if in the poorly ventilated spaces. For outdoor pollution, like you mentioned, it's emission from vehicle or diesel exhaust. So that's also can cause lung cancer.
Yeah, I remember I ride my motorcycle to work. I did at one point for quite a while.
Yeah.
And I would wear a filtered mask. And I remember every couple of weeks, if I changed the filter, how brown it got, basically yellow, and all that would have basically gone into my lungs without the air mask. So real quick, you mentioned secondhand smoke. That's one thing that we haven't touched on yet. There was, I don't know if this is a myth or not, but maybe you can clear it up for us. Some people said secondhand smoke can actually be worse for you in some cases. Is that actually true?
No, it's still the same.
It's the same.
The same risk for the active smokers or passive smokers.
Okay, so but if you're constantly exposed to it, then you're just as much as a risk for getting cancer.
Yes. So before, the myth is actually said that only smokers can develop lung cancer. But turns out it's not. If you have secondhand smoke, asbestos exposure, air pollution, you still can develop a lung cancer.
I had a friend actually that was constantly at meetings where smoking was allowed, and he wasn't a smoker himself, and he eventually developed it too. That's why I asked if it was at a higher risk because he wasn't a smoker even at all. Yeah, there you go. Any message, since it's Lung Cancer Awareness Month, that you would perhaps share with our viewers?
For those who smokers, please quit smoking for all. And then if you have a high risk of lung cancer, please do screening regularly and go to the doctor right away if you have any symptoms of lung cancer. I hope you all health and in a good health, and hope you have a good day.
Very wonderful,
Very
Doc.
well said. Thank you so much, Doc.
Yeah, certainly learning a lot in regards to this, because there are a lot of misconceptions when it comes to these newer technologies.
Exactly,
vaping,
and you
smoking,
think
and
you're compromising some alternatives, but hey, it turns out it's actually still as bad.
There you go. Stay healthy, everyone. Thank you, Doc, once again, and we're going to take another short break here. We have more updates coming your way when we return here on the C Morning Show. Do stick around. We'll be right back after this.